I'm Dr. Namita, consultant, a physician practicing in Bangalore. Today we're going to talk about a symptom which is quite distressing to many patients, that is the heartburn, and understand its association with anxiety, how it is associated with anxiety. Coming to start off, what is heartburn? Heartburn is a feeling of a burning a sensation or a bitter taste in your mouth. This can happen when the acid refluxes from the stomach into the lower portion of the food pipe, which is called as the esophagus. Okay, so this can happen especially after taking after taking a very large meal, heavy meal, which causes the lower esophageal valve to relax, allowing the acid to flow back into the lower portion of the food pipe, which is the esophagus. Okay, resulting in the symptom that is the heartburn. If you experience heartburn more than 2 times a week, then it may be indicative of an underlying condition called as a gastroesophageal reflux disease. This is quite common and is prevalent in many of the patients. So, one of the most common symptom in the gastroesophageal reflux disease is the heartburn, which I already described as a feeling of bitter taste or burning sensation in your throat. It typically happens after taking meals. Another symptom which most patients can complain is the regurgitation. Regurgitation is typically described by most of the patients as a feeling of an acid in your mouth, which is often mixed with undigested food particles. Heartburn and regurgitation are the most common symptoms of the gastroesophageal reflux disease. However, patients can also present with other symptoms such as nausea. They can complain of difficulty in swallowing, painful swallowing, a feeling of a globus sensation, that is somewhat choking sensation in your chest. Some patients can also complain of a water brush, that is a sudden salivation in your mouth, which happens as a as a response to the reflux. A few other symptoms that can be non-esophageal or extra-esophageal symptoms. For example, a chronic cough. A patient can also complain of hoarseness of voice because of continuous acid reflux. As far as now coming to the association between anxiety and heartburn. As far as anxiety is concerned, anxiety doesn't have a direct role on the gut. Okay, but it can affect the brain, which is very important as it sends certain signals to your gut, which are called as the neural reflexes. So, if you experience excessive worry, okay, are constantly worried, so this will usually trigger a sense of threat in you. So, this sense of threat can give rise to a lot of symptoms such as tremors, feeling of cold hands, that can be palpitations, that can be heartburn, and some people can even have fainting spells. How exactly anxiety can result in heartburn? So, what exactly anxiety does is that it sends it basically stimulates the brain to release signals, which causes the lower esophageal valve. So, the esophagus or the lower end of it has got a valve which is very tightly closed. So, because of these brain signals, it opens, or the valve relaxes, allowing the acid to enter back from the stomach into the esophagus. Most of the patients who are anxious would have a functional heartburn because of this underlying mechanism. When anxious patients develop heartburn further causes stress. Okay, so this stress again further releases these signals, okay, resulting in further heartburn. So anxiety and heartburn go hand in hand, resulting in a vicious cycle. So most patients suffering from anxiety would be continuously suffering from heartburn as well. How can we diagnose this gastroesophageal reflux disease? Mostly, we diagnose gastroesophageal reflux disease by, the classical symptoms, which is the heartburn and regurgitation. Okay, if required, then we also do the tests for identifying or for confirming the diagnosis, which is mostly the upper GI endoscopy and the esophageal manometric test. So, manometric test will mainly measure the pH in the lower part of the esophagus and help us in making a diagnosis. Okay, so once diagnosis is made, how do you treat the gastroesophageal reflux disease? Since most patients would commonly be experiencing whatever symptoms I've earlier described, at some point in their life. So, some brief episodes of heartburn are quite common, which can happen in response to the food that the person has taken. But if it is very recurring and repetitive, then it may indicate an underlying problem. Okay, so first step to treat the gastroesophageal reflux disease or the heartburn would be mostly by the lifestyle interventions of a lot of factors, which is mostly the eating habits. Okay, we advise our patients to change their eating habits, not to eat too fast. Okay, not to have a very large meal at once. Okay, not to immediately lie down after having a large meal, as this would further make the acid go back into the food pipe, resulting in these symptoms. Okay, asking I we also ask our patients to wear a loose clothing, not very tight, which would further increase the pressure in the abdomen, causing the acid to reflux further. Food habits also, restrictions are advised. You have to avoid spicy food. Okay, advise, you have to avoid certain too citricy fruits. Okay, avoid deep fried fatty foods. Prefer plant-based fats when compared to the animal fats. Okay, avoid chocolates, caffeine, tea. Okay, carbonated beverages, which is the commonly used Pepsi, Coca-Cola. So all these can further trigger most of the symptoms. In addition to that, losing weight is also very helpful, as losing weight would decrease the intra-abdominal pressure, hence preventing the reflux of the acid into your esophagus. Okay, smoking is another common trigger associated with the heartburn. So smoking is definitely advised to be avoided. Weight gain, so this is another trigger that we see with most of our patients. Losing weight actually helps in relieving many of these symptoms. Other than that, we also advise the patients to sleep with a little elevated head by using multiple pillows, or a wedge pillows can help, as it reduces the reflux of the acid. Sleeping on the left side also helps, because it doesn't allow the acid to suddenly move back into the esophagus. So all these lifestyle interventions would mostly help these patients when the GRD symptoms initially begin. However, when the symptoms are distressing to our patients and not controlled by these lifestyle interventions, we also advise medications which are usually available over the counter, commonly known as the antacids. So, antacids are mostly available either in the liquid form, okay, which can be taken as and when required whenever there is a bout of symptoms, and when the symptoms are too frequent, we advise the oral tablets, which are the commonly used antacids, which are the pantoprazole, omeprazole, esomeprazole. So as per your doctor's advice, these medications are advised. So these medications, what these medications exactly do is that they will reduce the acid production in your stomach, and thereby the reducing the reflux into the lower part of the esophagus. So this is how we treat our patients with the gastroesophageal reflux disease. But however, patients who have anxiety have something called as a functional heartburn. So just treating or reducing the acid production in the stomach would alone not be sufficient, because as I already discussed, anxiety definitely affects the brain, which results in heartburn in most of the patients. So this requires a multi-targeted approach. Okay, anxiety itself needs to be treated by multiple counseling sessions. We sit with the patient, identify what is the exact trigger for the anxiety symptoms, and certain relaxation techniques would help in relieving anxiety. If it is too severe, then anti-anxiety pills also would be advised. Overall, I would like to conclude saying that most of the GRD symptoms needs to be managed by a multi-targeted approach. Not just treating by reducing the acid production by using antacids would not be sufficient. Lifestyle interventions, lifestyle changes are most essentials. If underlying anxiety or any other factor is present, would also require to be treated to have a complete resolution of the symptoms. Thank you. Thank you.